Malnutrition. Malnutrition is a term used to describe the general problems resulting from inadequate intake of nutrients or an imbalanced intake of these nutrients. Not having a proper diet causes the body to not receive the necessary vitamins, proteins, and minerals, ultimately leading to the breakdown of body muscles. Contrary to common belief, malnutrition does not mean a lack of nutrition. Rather, it means improper nutrition. As a result, this condition can be divided into two different types. A. Nutrient deficiency. In this type, the body does not receive enough calories, minerals, proteins, and vitamins. Therefore, when the body breaks down or at a younger age, it can lead to insufficient growth relative to age and height. B. Excessive consumption of inappropriate nutrients. In this type, excessive and inappropriate nutrition leads to severe weight gain. In this type, although the amount of food consumed is very high, the necessary and sufficient vitamins and nutrients do not reach the body. There are many reasons for malnutrition, including 1. Very low and inadequate food intake. Low, inadequate, and incorrect food consumption prevents the body from properly providing the energy needed for its functions. Specific illnesses, liver problems, severe nausea, difficulty swallowing food, consumption of certain medications, dental and oral problems, and other such issues can also cause loss of appetite. 2. Lack of mental health and hygiene. Mental and nervous problems such as depression, anxiety, obsession, mental decline, psychosis, and nervous anorexia can lead to malnutrition. 3. Economic, social, and mobility problems. These problems can have a negative impact on your nutrition and prevent nutrients from reaching the body properly. 4. Digestive disorders. If the body does not absorb nutrients properly, malnutrition can occur, even if a healthy diet is present. 5. Alcohol consumption. Alcohol consumption causes stomach swelling and damage to the stomach lining. These seemingly insignificant problems prevent proper absorption and digestion of nutrients and vitamins. It also disrupts the body's metabolism. One of the other problems with excessive alcohol consumption is that it is high in calories and can create a false sense of fullness, preventing the entry of necessary substances voluntarily. What are the symptoms of malnutrition? Malnutrition has multiple symptoms, including inability to concentrate, frequent illness, dry skin and hair, depression or anxiety, persistent fatigue and weakness, inability and delay in wound healing, loss of appetite and interest in food, severe decrease in body fat or muscle tissue. Of course, the signs of malnutrition in children can sometimes be slightly different and can also hinder proper child growth. Problems in learning, slow mental development, and bloating of the stomach can also be signs of malnutrition in children. The concept of malnutrition, as explained in medical descriptions, can also be observed from an artistic perspective in the works of Kate Kollwitz, a famous German artist. Kollwitz, known for her powerful and emotional works, addresses themes of suffering, poverty, and social injustice with raw and uncompromising honesty. The poignant life of Kollwitz is intertwined with the narrative of malnutrition. Living in a working-class neighborhood in Berlin with her doctor husband, she endured personal tragedies that deeply reflected her artistic expression. Losing her son in World War I and witnessing the suffering of her mother due to the deaths of 3 siblings before and after her birth exposed this artist to the profound suffering experienced by her family. After her marriage, in bitter details of life, Kollwitz's art was also influenced by her husband's medical practice. Accompanying her husband in visits to poor patients from the working-class community, she witnessed up close the damages of malnutrition and the effects of socioeconomic factors on individuals and families. Therefore, her paintings and designs evoke a deep sense of empathy and compassion, connecting her intimately with the harsh realities of life. Through Kollwitz's art, the destructive effects of malnutrition are not only depicted visually but also felt on an emotional level. Her works serve as a reminder of enduring struggles for those marginalized due to poverty and social inequalities, inviting viewers to confront the human costs of neglect and deprivation. In this convergence of artistic insight and medical understanding, Kalwitz's works manifest as a testament to the lasting power of art in illuminating the darkest corners of human experience. Kalwitz's works, in a collection about poverty and hunger, depict the physical and mental damages of malnutrition on the human body. Through detailed and vivid images of frail and weak bodies, sunken eyes, and gaunt faces, Kalwitz conveys the detrimental impact of insufficient nutrition on individuals and communities. Her art serves as a poignant interpretation of social and economic conditions that warns about malnutrition and its consequences. By portraying these physical manifestations of malnutrition, Kalwitz expresses her goal of raising awareness about the urgent need to address issues of poverty, hunger, and inadequate access to nutritious food. Furthermore, Kalwitz's exploration of topics related to mental health and social inequality resonates with the fundamental causes of malnutrition. The artist's focus on the psychological and emotional impact of poverty and deprivation emphasizes the complex interplay between mental well-being, socioeconomic factors, and nutritional health. As a result, her powerful paintings continue to serve as a reminder of the enduring connection to addressing issues related to nutrition, poverty, and social justice in contemporary society.